The parallels between the coronavirus pandemic and the Spanish flu that ravaged our world more than 100 years ago are striking. In Washington state, the Spanish flu outbreak peaked in the final months of 1918. And like we're seeing today, when the number of deaths began to decline, many removed their masks and let their guards down. Historian and executive director at MOHI, Leonard Garfield.
Seattleites could stay home no longer. They poured into the streets. They gathered in large crowds downtown, and the newspaper reporters said that there was not a mask in sight. They thought they were in the clear, but they weren't.
The second wave of the Spanish flu hit in late 1918. Let's compare. Today, it's been nearly 4 months since the first case of coronavirus was reported in Washington state. And in that time, there have been just under 1,000 deaths linked to the virus. According to old CDC archives, the first 4 months of the Spanish flu outbreak resulted in the death of an estimated 4,500 Washington residents. Then after 4 months, the second wave of the Spanish flu took hold. The new spike later that winter resulted in the death of another 2,000 Washington residents, according to our breakdown of old health records. That means 50% fewer cases in the second wave. To slow the spread of the flu the second time around, local officials took more drastic measures.
They quickly took action, but they realized they could not force everyone back home again. They could not close businesses down again. So what they did is they focused very intensely on people who presented as symptomatic.
There's no way to know what the future holds today, but warnings from top health officials indicate a second wave of the virus is almost certain. It's only a matter of how we're prepared.
And Mimi, so bottom line, Spanish flu, far more deadly, at least so far, that we've seen against coronavirus. 6,500 people died of Spanish flu then. A big distinction, which was interesting, Spanish flu emerged entering into the fall flu season. COVID-19, as we know it, emerged into spring. And there was another resurgence, a third and fourth wave into the fall the following year, Mimi, as we are likely expected to see with coronavirus, but it was only about a quarter of those cases.
Well, it's good to look back and try to learn from the past and also be prepared as we head into the future.